We're honored to have in the studio with us this morning Dr. Jerusha John, a member of the Right to Sight Trust. Dr. John, good morning to you, and thank you for joining me on the program this morning.
Good morning, Faisal. Thanks for having me.
It's an absolute pleasure, absolute pleasure. Now, I introduced you as a member of the Right to Sight Trust. Tell us a little about the Right to Sight Trust.
So the Right to Sight Trust is sort of an arm of our parent body of the Ophthalmological Society of South Africa, which has, we see, a social responsibility to give back to our community. So that is, we are involved in outreach programs and things like that. Yes.
Excellent. Now, I did introduce this topic as we're discussing cataracts. Now, as I said, cataracts remain the leading cause of blindness globally. And I also said that in South Africa, an estimated 250,000 people are blind due to untreated cataracts. Now, why do you think that cataract treatment has not been scaled up to meet the demand, given that surgery is a cost-effective intervention?
Yes, you're right. There's a huge amount of people that are blind from cataracts. The little blurb that we have is that it's preventable blindness, but it's actually, we cannot prevent cataracts because it is a natural process of aging. The older we get, the duller our lenses inside our eyes get. We call that then cataract. And then it's a surgery which is quick and reverses that element of blindness. But it requires skill. It requires people who are well versed in doing these surgeries. It requires teamwork from doctors, nurses, management to be able to carry out these surgeries in a safe, under safe conditions. So, yeah.
Now, many public hospitals in South Africa lack the ophthalmologists and resources required to treat cataracts. What would be the most urgent solutions to address this issue and reduce the backlog of patients waiting for surgery?
Yeah, so you're right. We're talking about resources again. We have a very small number of ophthalmologists in the country compared to other disciplines. But a cataract surgery doesn't need an ophthalmologist. A medical officer can also conduct these surgeries, but it comes down to a matter of human resources. Do we have the manpower, woman power available to be able to reach the larger community? So the issue is although we may have consumables and software and hardware at our disposal, we need people to actually get in there. So, and then your question was about what we can do to upscale. Yeah, so if we can get more staff on board, that would be first prize. Really, the more people we have trained in this discipline, the more people we have trained in cataract surgery, the more the load is shared. And it's not just doctors, it's nurses as well. We work as a team.
Now, I think I did mention that, we understand that the cataracts can develop earlier and more rapidly in people with diabetes.
Yeah.
Now, how important is diabetes management in preventing early cataract formation? And what role does education around this issue play in your work?
So diabetes is extremely common amongst our population. And as you say rightly, can lead to earlier cataracts, but not just cataracts. Diabetes has dire consequences in the whole eye. And if not managed and controlled, can lead to a state where the blindness becomes irreversible. However, cataracts themselves can develop earlier in a diabetic. So diabetics all need to have screening done of their eye, especially the retina, the back of the eye. And if there are cataracts that are preventing that screening process, that needs to be addressed via surgery.
At what age do these cataracts normally occur? I know you say it comes over time, but from what age should one be testing for these cataracts?
So largely cataracts are, we see the worsening effects of duller and duller lenses in the elderly because it develops with age. So the same way we go gray, the same way we get wrinkles, if we all get old enough, we'll all get cataracts. So other things can lead to earlier cataract development.
Mm-hmm.
As we said, diabetes is one.
Okay.
Trauma is another.
Okay.
Trauma, even if it was decades ago, can lead to cataracts and even an asymmetry between your vision between your both eyes, because trauma usually is then on the one side.
Mm-hmm.
So other things that can cause cataracts, there are certain conditions in childhood. So one can see children with cataracts. So there are many different reasons why cataracts develop, but by and large, we see them in the elderly because of the age.
And what are some of the biggest misconceptions people have about cataracts and eye health in general? And how can the public become more aware of preventative measures?
So I think that with cataract and them developing gradually, one sort of gets used to the idea that this is my vision.
Mm-hmm.
And I don't see an actual difference, perhaps until it is quite advanced. So it's not necessarily that patients will present earlier, even though they have cataracts. They just don't notice it.
Mm-hmm.
But one does need to consider the difference between the two eyes, as well as is your vision actually deteriorating? I'm at my age, I probably also have a small degree of cataract. However,
You mean
functionally,
you mean it's not so early in life? Okay.
so functionally, it does not affect me. But for someone else, it would be for perhaps somebody older than me.
Mm-hmm.
To not be able to make yourself a cup of tea, to not be able to see, to walk 10 steps in front of you, that's functional disability. So the main symptom is loss of vision.
Mm-hmm.
There's nothing else that goes with it, like pain or irritation. Loss of vision is the main symptom. And if you have that, it may not just be cataracts, maybe something else. But the most common condition is cataracts.
Mm-hmm.
So one would need to go to your local clinic, whether
Mm-hmm.
it is your GP, whether it is your optometrist, or an ophthalmologically trained sister, to have an assessment done. Because perhaps the loss of vision is just due to a glasses problem, where perhaps glasses can improve your vision,
Mm-hmm.
or the optometrist may pick up something else more than cataract. So one needs to have a full eye assessment made before deciding this is the diagnosis and this is how we're going to treat it. But with cataracts, I think if you're noticing your vision is dropping, please do go and present to your local clinic or optometrist to have your eyes assessed, because perhaps a very simple, quick procedure can be done to reverse the condition and restore your sight.
Now, there's a question that's come through. All they ask is that they refer to certain medication. I'm not going to mention those names. What they want to know is that, is there any medication, or they refer particularly to a tablet that can help cataracts? Or do you have to do surgery?
No, that would be a miracle drug. There's no
Okay.
such drug available, no medicine to help reverse cataracts. Unfortunately, not currently.
Mm-hmm, mm-hmm, mm-hmm. Okay, actually they refer to a tablet. They say my wife used to take this, a very expensive tablet, 250 mg for the eye, but obviously that's not for cataract. So let's thank you for that question, Brother Junaid.
Yes, thank you for that question. One thing one can do is to protect your eyes from UV light, but it's not necessarily going to prevent you getting cataract, but it may slow down the rate.
There's another question that's come through. It says that if my optometrist told me 2 years ago that, look, in the next 8 to 10 years you'll be developing cataracts, I can see it starting. Is that correct? Does it take that long to develop?
It can take many, many years, decades even.
So are there any preventative measures that one can take?
So again, nothing preventative.
Okay.
But just to be cautious with your vision, with your eyesight, wear the sunglasses. for your skin, put on the sunscreen, all these things. Take your vitamins, eat a balanced diet, live a balanced lifestyle. All those things contribute to overall general health and wellness. And so the eyes are part of that. Yeah.
Excellent. Now, although cataracts are often associated with aging, as you said, what advice would you give to the younger people to protect their eye health and reduce the risk of developing cataracts? Now,
So-
I know you did mention
Yes.
the lifestyle, but let's
Yes.
go beyond that.
If you do notice any change in your vision, even if it's small, even if it's not a change in vision, perhaps if it is something else, some pain, some irritation, pain in sunlight, not being able to be in a brightly lit room, those types of things all have to do with your eye health. Go and see a doctor for that. It may make the difference, and you don't have to live with these symptoms. It may be able to be resolved. So please go and see someone. Yeah. Don't wait.
Yes, and I'm sure recently with our famous cell phone and our continuous viewing this thing, sleeping with it, many of us, I'm sure this aggravates a condition.
So I think you probably mean in terms of having
Lack
to look
of sight.
near all the time and not having a reduced blink rate, the light from the phone. These are not contributory
They're not.
factors
Okay.
to cataract development.
Okay,
Yeah.
excellent.
Yeah.
There's a question that's come through. That's from one of the listeners. I'm not sure if it's got anything to do with cataracts, but you can deal with it if you want to. Okay. It says, Salams, can you please update me on macular hole? And I was told that my sight is very poor. And I'm not sure if that's related to your field.
It's related to ophthalmology. Everything about the eye is related to
Okay.
ophthalmology. A macular hole is complete change in tack. It's not to do with cataracts at all.
Okay.
There are different reasons why a macular hole will develop. So the macula is that area of your retina that gives you your central vision, the vision that you need to look at things. So to look at people's faces, to read your book, to watch the TV. That area is prone to damage. As we get older and things get thinner in the eye, the jelly of the eye gets thinner, the retina gets thinner. This area of the eye can also get thin, and then it sounds funny to say one has a hole in one's eye. It's actually just a separation of tissues.
Okay.
It's not, we just term it macular hole, but it's not that there's a hole in your eye.
I was just wondering.
The eye is still a closed system. It's just that the tissues have separated. But this has nothing to do with cataracts, though. Although if one has a cataract in the condition of a macular hole, one can still have the cataract surgery done, but one would still have that central area of vision lacking. So there is surgery to address that situation. But it's tricky and finicky surgery, different to cataract surgery, as well as the outcomes may not be what one always hopes for it to be, in terms of vision.
Now, there's been a lot of technological advancements insofar as cataract surgery is concerned. I mean, I recall there was a time when it was a major thing to go for it. Today, it's like just one of those things. When I say one of those things is not as problematic as it used to be. You just talk to us about the technological developments.
So,
Or what can I expect if I'm going for a cataract operation on Monday?
Okay, so
that might be an easier way to put it.
Okay, I can take you through kind of a walkthrough of what the patient would experience. So, firstly, the eye needs to be assessed in totality to see what are the actual reasons for the visual loss. If it is decided cataract is a contributing factor, one would then have a cataract surgery booked on a theater slate. So it's not done in the doctor's rooms, it's done in theater.
Okay.
So in order to prepare for that surgery, you have your eyes tested. In order for us to have the correct measurements for your eye, because someone else's eye will have different measurements. So it's like when you go to an optometrist and you test for spectacles, you're not going to see any clearer if you use someone else's spectacles. The correct measurements need to be done on your own eye. And then when it's time for theater on the day, it's a day case. You come in the morning, you get prepared for theater, change into the theater gear, get drops into your eyes. When you get to theater, you can get more drops in your eye to numb your eye, or even a tiny injection in the tissues around the eye to numb the area, so that the surgery is comfortable for you. Excuse me. So we don't want the patient to have any pain, and a lot of patients actually fall asleep during the surgery.
Is it? Okay.
Well, you lie on the operating table. The sister cleans the eye. We cover the face and the body with clean, sterile drapes. We dress the eye, and we work on the eye with very tiny, tiny cuts, just a quarter of a centimeter and less. And then we wash out the cataract, do the work, and then, because the cataract is one's own lens inside the eye, which we are born with as clear lenses, and with time they become dull. It's one's own lens that has become dull. When we wash that lens or cataract out, we then replace it with a synthetic material inside the eye. It's like wearing spectacles on the inside of your eye, measured for you.
Amazing.
And then that stays in lifelong. So we take out the dull lens, we put in a clear lens.
Okay.
You see,
okay.
and it's 15, 20 minutes, and the surgery is done.
Wow.
Then your eye gets dressed. You get medications. You come in the next day for your checkup, and all subsequent appointments are also important to keep.
So are you under full anesthetic? How does it work? No.
No. By far, it's a local anesthetic. So again, the injection around the tissues of the eye, or the eye drops. If for some reason the patient cannot tolerate this type of procedure under local anesthetic, then we would move to general anesthetic. But there are very few and far between those cases.
Okay, let's. I asked you when we started to tell us what's Right to Sight about. Right to Sight Trust. What's it about? Before we round up, I'm sure there's a lot of outreach efforts that are taking place insofar as eye care is concerned. Maybe you can just appraise us of some of those efforts.
Yeah, so this month, October, spanning from September to October, is Eye Awareness Month.
Okay.
It comes around every year. And on the 10th of October, or 10th and 11th, the World Sight Day. So there have been outreach efforts across the country during this month. And not just during this month, although this is Eye Awareness Month. We have outreach efforts the whole year through to address the backlog of cataracts in the country, which it's dire, and it's reversible blindness. So, for example, I can give you, just down the road, we have McCord Hospital. We have an amazing team of doctors and nurses there who are doing lots of these surgeries, hundreds a month. So during the past week, we have, not this week, the previous week, we've had every day a different NGO coming to help sponsor consumables in order to get these surgeries done for the community. And last week, there were 246 surgeries done at McCord Hospital.
Wow.
We had another outreach effort. That is just in 1 week. We had another outreach effort in Port Shepstone Hospital on the previous weekend. We reached 83 people.
Fantastic.
So, and NGOs like Gift of the Givers, Al Imdad, they're coming on board, many NGOs, to try and alleviate the problem. Again, it's the matter of having a lack of human resources. So we would love to have more staff on board, to get more doctors trained to do the surgery, to get more nurses, scrub sisters, to have this element of camaraderie and teamwork. And it's a joyous thing. When these surgeries are done, everybody is elated to have helped so many people.
Absolutely. In fact, I spoke to a few people by chance who had these cataracts things sorted out. And see, that's amazing. They're experiencing a new world now.
Yeah.
It's really amazing. There's quite a few questions that have come through, but I'm not going to pose them because none of them are related to cataracts. But the one, I'm just going to make one comment that's come through. It comes from, it says, Assalamu alaikum wa rahmatullahi wa barakatuh. Always interesting programs. What about the saying that carrots are good for the eyes? Is that true?
Carrots are good for your eyes. as are all other vegetables, and a balanced diet.
Okay. Okay. Dr. Jerusha John, thank you very much for joining me in the program this morning.
Thanks.
I think it's
thanks so
very
much.
interesting discussion, but I'm sure you have a small message for our listeners.
We want to help you. If you have a problem with your eyes, please just come and we will see what we can do to help you. I'd like to just also thank my colleagues at McCaw's Hospital, Port Shepstone Hospital, for doing amazing work. You know, these outreach efforts, they're not just involved it's not just public sector doctors that are involved, it's private sector doctors that are also coming on board, giving off their own free time and energy to help just give back and do something for the community, because we can see the struggle is real.
Thank you so much. We spoke to Dr. Jerusha John, a member of the Right to Sight Trust. She spoke to us about cataracts. And of course, cataracts do remain the leading cause of blindness globally, despite being completely preventable. So this is a preventable situation. To take the necessary steps.